My weight loss surgery journey has been an interesting one. I had surgery 6 years ago. My life now is so very different to how it used to be. My confidence and self-esteem is very different. I love life now, whereas before I was just existing. That's the difference. And ultimately what weight loss surgery has given me is a little baby boy, and I didn't ever imagine being a mum, even at my age, you know, and I am, and that's, so it's not only visually how you look and the health benefits that you get from having surgery, it's also brought me a result of a baby as well. After surgery, my attitude and relationship changed with food. I always saw food as an addiction. And I guess having had the surgery, I had to look at why it was that I used foods as an addiction, and looked very closely at my behaviour and changed my lifestyle to work with the surgical procedure that I had. Now it is a very healthy relationship. I don't use it like I used to. I'm not addicted to it like I used to be. And ultimately my surgery helped me change that relationship with food. Having lost 15 stone since 2004, I hope that I can be an inspiration to other patients, because trust me, if I can do it, any patient can. As a patient, having had the surgery myself, I thought that that was all I would need to do, is have the surgical procedure. Actually, it's not right. You do need some really clear guidelines and aftercare in place to make that surgical procedure that you've chosen to have and ultimately put your body through a success. Having had surgery myself, I realised very quickly and identified that there wasn't a lot of aftercare out there in the industry to help me on my own journey. So I actually went out there to look for it myself and found a wonderful clinician called Wendy Stubbs, who has actually helped me in the last 6 years achieve what I have achieved. The weight loss surgery group is different with regards to the service that we offer. It's a very personal, family orientated service, ultimately because we've had the experience within the business of dealing with patients on a one-to-one basis for many years. The multidisciplinary team that we have has lots of experience working with lots of different patients, and we've seen a lot of success and weight loss over the many years that we've been in business. Weight loss surgery is a big commitment to make, not only financially, but it's a drastic option for the patient to put their body through. So it has to be right. With the right support and guidance, there's no reason why you can't be a success by having weight loss surgery.
Hi, my name's Wendy Stubbs. I am a registered nurse. I class myself as the honorary title of a bariatric nurse consultant, and I am the clinical director for the weight loss surgery group. I consider my role to be very unique, assessing patients preoperatively, creating and helping them choose the right surgical procedure for themselves based on lots of factors, including lifestyle, eating behaviours, medical problems, not only their weight and BMI. There's a lot of factors that go into the procedure choice. We do form a very good relationship, and it's like coming to see a friend. There are some patients that find it difficult to adapt to a new lifestyle. That's a challenge that we do take, and we take it very well. And we guide them, like Michelle has said, by the hand, until I'm confident that they're competent to lead a normal life. There has been some issues where we have had to keep a straight face when someone has admitted to us that they've been doing something wrong. One gentleman once rang the on-call phone to say that he'd accidentally eaten a sausage when he should have been on a fluid-only diet. During the 3 years of aftercare, I like to think that the window of opportunity for weight loss is in the first 12 months. This is where a really robust teaching programme takes place. We have support groups, we have one-to-one sessions. Patients have an open door policy where they can come and see me or a member of the team at any time. We have 11 centres where we can see patients, but we also have an online support team as well. Patients sometimes like to come to clinic very often because they may need that input, whereas some patients might need just a touch base telephone call once a month. So we identify the patient's needs by asking them what they want, and we allow them to dictate their level of care. Historically, bypass surgery was an open procedure, and now all bariatric surgery is primarily attempted laparoscopically, which is keyhole surgery. Keyhole surgery is by far the most common procedure to reduce the risks in theatre, reduce anaesthetic problems and bleeding and infection.
Because we recognised that the industry wasn't delivering aftercare to the patients, they weren't delivering what they promised. And that is crucial because, like I said earlier, you know, patient invests in this. This is a big financial investment to them, not only emotionally, psychologically, but financially. So it's got to work. I think we've created a fantastic business to support and guide patients that are thinking about having surgery and patients that have actually had surgery and now just want aftercare only. We're proud of that.